some people have mentioned, either from their own experience or from friends, that they get intimidated with the thought of a CO2 laser.
Well, I'm glad you asked that question because that's kind of easily answered. First, the lasers are better than they were in the past. We use a fractional ablative CO2 laser, which means that some of the skin in between the laser dots that are hitting the skin, our normal skin, are untouched, so the healing process is faster. The other thing, our preparation. We definitely have an individual consultation with each patient about the preparation before having a CO2, as far as sun exposure, as far as using specialized products to prep the skin. Also expectations. Many people go into a CO2 laser and don't really realize there will be some downtime. By telling the person realistically what the downtime is, works much better. Pain control, that's another thing. Pain control and relaxation are keys to having a successful procedure. We make sure we employ something like an anti-anxiety medicine, a pain medication before the procedure, and that makes the procedure go much, much better. The results are fantastic. There may be 3 or 4 days of downtime. After that, you'll just look quite red, but after the first week, you look like you maybe had a slight sunburn, but by 2 weeks, you look really fantastic. Most people are back at work by day 4 after the procedure.
The offering of the CO2 laser and the photofacial, which one is the correct one for each type of person?
Well, the photofacial is a broad spectrum of light. It's not one particular frequency of light, and it's really there to get rid of irregular pigmentation and dark spots on the face. It's definitely not as intense as the CO2 laser, and there's really no downtime with that. You just end up with a few dark flakes coming off of the face. The CO2 is a single wavelength, which goes for water as its target, and actually causes slight burns in the skin, but it's a controlled injury, and with that you get a controlled healing and tightening. So really the idea of the CO2 is facial tightening and lifting, whereas the photofacial is there for irregular pigmentation and dark spots.